Welcome, everybody. Thank you for joining the This is Public Health virtual mini fair. I'm Nick Mahoney, Senior Manager of Student Services for ASPPH, and I'll be moderating today's event. We ask that you stay muted with your video off during the formal part of the presentation. Using the chat mechanism shown here, you may ask questions or submit comments in writing anytime during the webinar. Simply click on the chat at the bottom of your screen and type them in the pop-up box. We ask that you ask general Q&As during this time and ask specific questions later in the event during the breakout rooms. If you'd like to see how just the speaker's view, you click on hide non-video participants and you'll only be able to see people who are presenting today. Our presenters today are Drexel University, LSU, Ohio State University, Tulane University, University of California, Berkeley, University of Michigan, and University of Minnesota. All right, great. We now welcome our first presenter, Drexel University.
All right, thanks, Nick. And thank you to all the participants that are joining us today. As Nick mentioned, my name is David Wood. I'm the Executive Director of Recruitment at the Dornsife School of Public Health. A bit about Drexel University. It is a comprehensive global research university. It was founded in 1891 in Philadelphia, Pennsylvania, which is the 6th largest city in the US. The Dornsife School of Public Health is located on the University City campus found in West Philadelphia. We have close ties to the other two campuses at Drexel University, the Queen Lane campus where the College of Medicine can be found, and especially close ties to the Center City campus where the College of Nursing and Health Professions is found. Drexel University Online was one of the oldest and most successful providers for an online degree. This is especially pertinent for this particular 5 minutes because we do now have MPH degrees and MS degrees through the Dornsife School of Public Health that are offered completely online, and I'll go into a bit more about that. Also of note, Drexel University is the large institution. There are 24,000 total students, 10,000 of which are grad students, but the School of Public Health is certainly a much more personalized and smaller place. The Dornsife School of Public Health is committed to solving the world's most difficult health challenges. You can see a note here from the dean. It is truly public health, all about science, purpose, and action. Dean Ana Diaz-Rosa, Distinguished Professor of Epidemiology. She started her training down in Buenos Aires, Argentina, where she was a physician, came to the United States to do her training in public health at Hopkins, Columbia. Previously, before her time at leadership at Dornsife, she was the chair of epidemiology at the University of Michigan. So she's been at Dornsife for the last 6 years, and under her wonderful leadership, the research portfolio has quadrupled at Drexel and at Dornsife, and that's something that we're very excited for all of our graduate students at the master's and doctoral level. The Dornsife have played a large role in the school's history over these last 25 years, but most recently, Dana and David Dornsife, they gave a $9 million gift, which was able to establish a center on racism and health. The Ubuntu Center, which basically is a South African principle, which means I am because we are, just launched this fall. So we're very excited about the work that is being done, not only through the School of Public Health, but entirely across the university, led by Dr. Sherelle Barba, seen here in this photo. The Dornsife School of Public Health for U.S. News and World Report is ranked the #1 school in the greater Philadelphia area and top 15% in the nation. So a bit more about the school. I mentioned it being kind of a mid-sized school of public health. We have over 100 faculty members. It is, like I said, a very personalized place at a 5-to-1 student to faculty ratio. I'll show a listing of the different MPH offerings, master's and doctoral degree offerings that we have. And we have many research centers beyond the Ubuntu Center that was mentioned earlier. So here is a academic listing. Again, something to call out. It's not only the fully online MPH degree offerings we have, but we also do have hybrid and Also, then the face-to-face options. For flexible plans of study, we do now have an accelerated MPH that can be done in as short as 12 months. For some of our doctoral degree offerings, not only are the PhD programs fully funded, I did want to call out the DRPH, which is much more of a practice and leadership-based degree that is part-time for evening students, that is a pay per credit. So I mentioned the 12-month MPH that can be done in short as 1 year. The more common and historical pathway have been students that have taken on the 18-month plan of study. But then we also do have part-time options. This is, again, something that is exciting for students if the 24 or 33-month plan of study is the preferred route. So just a few more reminders about the Dornside School of Public Health. There are no requirements for any MS or MPH applicants. The practice-based component, the applied practical experience, integrated learning experience, is something that is very, very hands-on, with over 300 hours of experience for our MPH students. And then scholarship. Certainly how you are paying for the degree is something to be mindful of. At the master's level, over 95% of our students have received scholarship. That endowed scholarship deadline is this upcoming January 15th, if you are thinking about applying this admission cycle. And then over 95% of our students are employed within 6 months, or they are pursuing further graduate education once they are done at Dornside. Again, my name is David Wood, the Executive Director of Recruitment, but what I'd like to do now is turn it over to Courtney Martin at LSU's School of Public Health.
Thank you so much for the introduction. Give me just 1 second. I'll put my okay. Thank you, everyone, for joining us here today. As the previous person said, my name is Courtney. I'm from the LSU Louisiana State University School of Public Health, actually located in New Orleans, Louisiana. And I just want to tell you a little bit more about our programs today. Our tagline here is "Change the World, Start in New Orleans." And that is because New Orleans has a unique history in terms of public health in the United States in general. Our mission here is to advance the public's health and well-being through education, research, service, with a focus on issues affecting Louisiana. We're very proud of being in the city of New Orleans. There is no place like it, but it also has a long history of public health, and it is very often considered a place where you kind of the start of public health research. There are such unique challenges in a city like New Orleans and a state like Louisiana that we are able to provide our students with hands-on experience before they even graduate from their decided program. That's not to mention it's just also a beautiful city full of great food, great music, and a good time. The disciplines we offer at our school are behavioral and community health sciences, biostatistics, environmental and occupational health services, epidemiology, health policy, and systems management. We offer all of those as an MPH. We do also have MS options as well as PhD programs. We also have dual degree programs with the LSU Schools of Medicine, Veterinary Medicine, and Social Work. Why would you want to join us here at the LSU School of Public Health? We're, like every school here, we're going to be CEF accredited. Our student to teacher ratio is incredible at 3 to 1. We're really proud of the hands-on experience that our students have and the work that they get to do with the professors here who are working on some of the biggest public health issues in the state, including cancer prevention, AIDS education, and everything ranging from childhood diabetes to criminal justice. Obviously, you would want to apply through SOFAS. We are proud to offer all of our master's programs without having to take the GRE exam. And our tuition is incredibly affordable, both as an in-state student as well as an out-of-state prospective student. There are opportunities for research and community involvement. We have partnerships with over 100 organizations in the city and hundreds more throughout the state. And we work very hard to work with each individual student to help them gain and garner the experience that they need before they even graduate to build up their resume. So where do our students often find careers? You'll see that obviously they appear in a lot of city, state, and federal kind of organizations for public health, but we're also finding growing needs for non-for-profits and even public sector health, private sector health and environmental organizations. So if you have any questions about the scholarships, international student guidelines, I'm the person you would like to speak with. I can help you through anything. Please don't hesitate to reach out. I love hearing and talking to everyone, and I'm sure that's less than 5 minutes, but I look forward to seeing all of you in the breakout rooms or answering any questions that you might have later on. I will then pass it on to Shante at the Ohio State University College of Public Health.
Thanks, Courtney. Appreciate that. Hello, my name is Shante. I'm the Admissions and Assessment Coordinator here at the Ohio State University College of Public Health. I want to tell you a little bit about our programs. So we were founded in 2007. We've been awarding degrees since 1971. So we've been in the game for a while. We are accredited by the Council of Education for Public Health. We reside in a fully renovated and LEED certified building here on campus. We really want to practice what we preach when it comes to sustainability and environmental public health. We are ranked 14th amongst public universities, public health programs, and our Master's in Health Administration is ranked 7th in the country right now. And we are located in the state of Ohio in the capital of Columbus. So one of the things that sets us apart from other institutions is that all of our health sciences are located on one campus. We are a very large campus. We have about 65,000 students. But, you know, as with many other programs, one of the great things about being in the College of Public Health is that it is a smaller environment where, you know, you really do feel a sense of community. But, you know, as a large institution, we still have many, many resources and things for you to take advantage of while you are a student here. So to give you a general idea of what a typical incoming student looks like, if we can sort of, you know, narrow it down to what typical is, you know, we receive around 700 applications a year. We typically have an incoming graduate class of about 150 students. Certainly our MPH makes up the bulk of that, you know, and yeah, we really welcome and value diversity. We're always looking to increase that, whether that's race and ethnicity, whether that's gender identity, you know, the sky is the limit. You know, we really appreciate students bringing in their different backgrounds, both personally and academically. We do offer a number of different degrees here. So this slide just shows our practical degrees, our Master's in Public Health and our Master's in Health Administration. As you can see, we have a lot of different specializations. And so, you know, more than likely we can find something that fits your academic and career interests. We do have a 100% online program. That's our program for experienced professionals that focuses on community health leadership and management. And our other programs are considered, you know, residential in person. Something to consider, we also have sort of what are called academic degrees. So our MS and our PhD, where, you know, research is a large component of these degrees. You can also be involved in research through the MPH and the MHA. You know, but again, we have a number of interdisciplinary programs where we're working with other departments on campus to provide either interdisciplinary degrees or dual and combined degrees as well. We have a number of those kinds of programs too. So our admissions criteria is fairly general. You know, no specific undergraduate major is required. We're typically looking for a 3.0 GPA. We do not require the GRE for our MPH or MHA. We're looking for good analytical and communication skills. Public health experience is preferred, not necessary. And our international students do have to provide proof of English proficiency, as that's a university requirement. As far as what's required, we do use the SOFIS and HAMCAS application systems. As we are an accredited institution, you're going to provide transcripts, GRE scores for MS and PhD, letters of recommendation, personal statement, resume, and these are all going to be, fairly blanket across programs, but just to give you an idea of what we're looking for. Our deadlines, we do not require a separate application if you'd like to be considered for university fellowship funding. So as long as you apply before December 1, you'll automatically be considered for those. And otherwise, our deadlines do vary by program and specialization. So definitely, as you have questions about anything and everything, please just let us know and we are happy to help. All right, and at this time, I'm going to turn it over to the Tulane University School of Public Health and Tropical Medicine.
Awesome. I'm going to go ahead and widen my screen. I don't know if everyone can see it. Awesome. So my name is Dylan Hoffpower. I am an admissions counselor at the Tulane School of Public Health and Tropical Medicine. My email is down at the bottom. It's just dhoffpower1@tulane.edu if you guys ever have any questions. So I wanted to talk a little bit about our school and where we're located. We are located in downtown New Orleans on Canal Street, right near places you may have heard of like Jackson Square or the French Quarter. And I think as Courtney from LSU mentioned, New Orleans is the place to be. There's a ton to do and see and eat out here, which is awesome. But we are the original School of Public Health. We were founded in 1912. So we were the first school of public health in the country. We are accredited, and with the most recent US News rankings, we are number 12. So we're excited to say that we were the first and consistently up there in those top rankings. Something that is really unique about our school is that we have a wide range of departments that you can choose to study from. Everything from epidemiology to tropical medicine to health policy and management. And we are actually the only school that has a standalone tropical medicine department with its own programs and areas of study built into the school, which is pretty cool. So going more specifically into the programs within those departments. So we have an MPH, we have an MPH and TM, the Master of Science in Public Health, an MS, we have an MHA, and we are excited to announce that we now have 5 online MPH programs as well. Something to note with our online programs, it is a different application process, but we are still more than happy to help you through that if you choose the online route. And for our on-ground programs and our traditional degrees, those are obviously through SOFIS. And as you can see, under each degree, these areas of study or these programs fall under the 7 different departments that I showed you. What we do also to help our students interact with those departments and those program managers who lead the department is we want to put you in touch with a current student or a faculty member. So learning more is really just, an email away. If you shoot an email over to me, I will put you in touch with someone within the department. And that's how we want to help match you and make sure that whatever area of study you're interested in is the right one for you. Holistic admissions review. So we are kind of moving into that more holistic admissions review process versus taking such a hard look at your GPA or your GRE. We want to look at you as a whole, as an applicant. So obviously official transcripts from all universities that you have attended are required. Even if it's, one class from a study abroad, they're still going to find it and we're going to want to see that. So be sure to put all of those there. We get a lot of questions about what to put in your personal statement. So I just wanted to touch on that. we want you to be genuine. We want to know why you want to come to Tulane. So what makes the Tulane School of Public Health stand out to you? And which program and concentration are you interested in? How do you feel that this specific degree at Tulane is going to help you achieve your career goals? And what have you learned from success or challenges that you've been through in your past that you think would make you a unique or strong candidate for the Tulane School of Public Health? At least 2 letters of recommendation that kind of discuss your characteristics that might make you successful in a career in public health. And for PhD applicants, we require 3 letters of rec. Your resume, public health experience is not required. As always, that is going to make you a bit more marketable, and that's great to have, but it's definitely not required. We have students from so many different backgrounds, and we have a lot of non-traditional students who have been working professionally and kind of stumble onto public health later in life. So it's not required, but just include your work experience on your resume. And we are waiving GRE scores for our programs as of this time. So deadlines, we also are implementing a new scholarship application process into our holistic admissions review. So our priority deadlines, as you can see on this slide, and those actual deadlines are listed. But when you apply before a priority deadline, that just means that you'll be able to submit the application for scholarships, and you'll be definitely considered for those scholarships. Once you are applying between the priority application deadline and the final application deadline, our scholarships are going to go out, first come, first serve as students meet requirements for scholarships. And so we have that priority deadline to kind of help keep us on that timeline while we have those funds and scholarship and financial awards available. So if you're interested in the scholarships, make sure that you apply before the priority deadline. And just because you apply before the final deadline doesn't mean you won't be considered for scholarships, but the goal is definitely to meet that priority deadline. And again, you can see all of these dates on our website as well. One more thing I wanted to touch on is our pathways to public health. So like I mentioned, we have students that come from all different types of backgrounds, some straight from undergrad and some working professionally. So I'm doing a series now, and it's on Facebook Live every Wednesday at 1:15 p.m. Central Time. And I'm just chatting with some of our faculty members about their pathway to public health. Again, this is live on Facebook, and we're really diving into their experience and how they got involved in their specific area and into public health in general. It's open to everyone. We're also hosting many open house events. We have one this month on the 27th. I'd be happy to send you the registration information. It's completely virtual, which is awesome. And we just encourage you guys to connect with us. Please, please reach out to me if you would like to meet someone from one of the departments, or if you just want to talk to someone from admissions. And I hope to see you guys in my breakout room. Next, I'm going to turn it over to Ella with UC Berkeley.
Hello, everyone. My name is Ella Crawford. I am the residential and admissions recruitment coordinator here at Berkeley Public Health. And for anyone who's on the West Coast or is a little bit behind like me, good morning, and to everyone else, good afternoon. So to learn a bit more about Berkeley Public Health, I want to start off with our mission and vision. Not only are these the qualities that are really driving our research and our curriculum forward, but they're also really what we're looking for in prospective students. So if you value health as a right, strength through diversity, thinking forward and impact first, then you should really consider our school. Here's an overview of the different degrees that we offer. So I want to kind of distinguish a couple of them. Like many of my colleagues, we do offer a Master of Public Health or an MPH. We have both a 2-year as well as an accelerated 1-year. There's a couple of additional qualifications that our 1-year MPH prospective students need to have, and so that's available on our website to look over. On the right-hand side of the screen, you'll also see our concurrent MPH degrees. These take about 3 years to complete because you're not only getting an MPH, but also a master's at one of our other schools at the university. You can see the complete list there, but an example of that would be a Master of Public Policy and a Master of Public Health, and you'd be graduating with both of those in about 3 years. To round out our professional degrees, we also offer a doctorate of public health, which is a much more kind of interdisciplinary style doctorate. And then we have a 27-month online MPH as well. For our academic degrees, we have both MA and MS, as well as a PhD. And then finally, our joint programs is where we partner with another university within the area. So the most popular one is our joint medical program, which is where you would start at UC Berkeley and receive your MS, and then you would go across the bay over to UCSF and complete out your MD. When you apply into our school, you're actually going to apply into a specific concentration. So we don't have a general MPH. I would really encourage you to go online and look up these programs, read the curriculum, the overview, understand the research that the faculty in these concentrations are pursuing, and making sure that you're finding, the right fit for what you want to do. So why Berkeley Public Health? Well, if you know anything about UC Berkeley, we're really quite well known for our student activism, starting with the free speech movement. But I think that really gets at the heart of something a lot of our students embody, which is they want to see this world be a better place. And so they really are change makers before they even come to our institution. And so they're not only pushing, the field of public health forward, but I would also say they're pushing us forward. Our DREAM office, which stands for Diversity, Respect, Equity, Action, and Multiculturalism, they're going to be there not only to assist you as a student with tutoring help, but also as a prospective student. So if you're interested in talking to a current student about their experience at our school, the DREAM office is where you're going to go to reach out to one of those students. And they also offer advisement for their application. So if you're like, what is a statement of purpose? What exactly is an admissions office looking for in that? They are going to be a fantastic resource to you. Our admissions office is also happy to answer questions like that, but if you want to talk to a current student, they're there to help. So we're not tied to a medical school, which means we're not going to be only doing sort of more clinically based research. And for us, that means that you can really get into the breadth and depth of the interdisciplinary nature of the field of public health. And a lot of our students are really drawn to that. I would also say a lot of our faculty are. So they get to work with their colleagues across the university. Hands-on experience. So you're going to be working on real-world public health problems while you're in your classroom. You don't have to wait until you graduate to get into the field. We have an incredible connection to the Bay Area community, not only through research, but also through like network resources. Alongside of that, we have career services to help you once you graduate, as well as find that internship opportunity during our 2-year MPH. And then finally, I already mentioned our joint medical program with UCSF, as well as the concurrent degrees that we have across campus. So this is our school by the numbers. Our average funding award for the MPH last year was about $22,000. I would say it is quite a large range. It kind of goes anywhere from $2,000 to $55,000. And of our MPH students that were admitted for 2021, about 15% of them received an offer of funding. And then I want to draw your eye to the bottom of this screen, that final layer. You'll see that we have about 720 graduate students. I would say about half of that is actually our online MPH. And so our residential program is much smaller than that. You're going to have that sort of tight-knit community, small school feeling, but with the resources of a much larger university just at your fingertips. And then finally, we also have the demographic breakdown of our student body, and you can find more of those numbers available on the DREAM office page of our website. Here's a brief overview of the admission requirements. I really just want to draw your eye that for most of our programs, the GRE is going to be optional for this year. And I'm going to talk more about this during the breakout rooms. And so if you have more questions and you want to learn more about the admission requirements, how to submit a strong application, tuition fees, how to fund your education, and a lot more of the other resources available, please come join us. And if not, please email us and we'd be happy to answer any of your questions. All right, I'm now going to pass it over to my colleague at Michigan Public Health. Thank you.
Great, thank you so much. Okay. Good afternoon, everyone. My name is Mary Beth Carroll, and I oversee our recruitment and admissions team at the University of Michigan School of Public Health. I'm happy to be speaking with you today. This slide here shows you a beautiful picture of our school located in Ann Arbor, Michigan. And it is a very sunny day here in Ann Arbor. It looks very similar to this. So we hope at some point when you feel that you can make the trip to Ann Arbor, you will come and visit us so that you can really take in the sights and the sounds of what's going on in our community. Michigan Public Health is pursuing a healthier, more equitable world through education, research, and action. As a graduate of the University of Michigan, you become part of one of the world's largest alumni networks. This degree will give you worldwide recognition no matter where life takes you. And as a Michigan Public Health student, you'll join a top-rated program with a long-standing tradition of excellence. Our history dates back to 1941 when the school was founded. Believe it or not, this is where Blue Cross Blue Shield was created. The National Sanitation Foundation was founded. It's where even the first Earth Day was held, where flu mist was invented. And the polio vaccine was proven safe, potent, and effective at the University of Michigan School of Public Health. Our community has consistently earned top rankings for the programs and the different resources that we offer. And I'm excited to tell you more about that today. So let's take a turn and get to know a little bit more about Ann Arbor and the public health community. We recognize that the Midwest and that Ann Arbor might be foreign to some of you. I am happy to share that we do have 4 seasons and that preparation is key. As we prepare for winter, definitely going out there and purchasing a coat, hat, and gloves and boots is important. I usually tell students when I'm talking to them that at the end of the day, our programs are, anywhere from 2 to 5 years. So you come here, you live in the cold if that's not something that you always like, and then the degree will take you wherever you want to go in the world. So our students are very lucky to be able to live and learn in a lively college town that is consistently actually ranked as one of the best places to live as well. Ann Arbor really draws people from all walks of life, and there really is a place for everyone within our community. Just to give you a greater sense, we are about 35 miles outside of Detroit, and we offer a lot of the same amenities that you would find on the West Coast or the East Coast and some of those major cities, but on a much smaller scale and a lot more affordability as well. So next we'll talk a little bit more about the School of Public Health. If you're interested in research, our portfolio is about $80 million a year. And for a little bit more context, we are one of 19 of the different schools and colleges that actually compose the greater University of Michigan campus. There is flexibility within our curriculum for students to take courses at any of these colleges or programs outside of the School of Public Health. We really want our students to feel as though they are the drivers behind the curriculum and the experiences that they have. So all of our students are truly able to tailor their degree to what they want it to be. Another thing, just to kind of go into a little bit more, showcasing some numbers about our school. As you can see, we have just over 1,000 graduate students. This includes our residential and online communities. And as a public health student, you have the opportunity to join over 40 student organizations. As noted here as well, our student to faculty ratio is 9:1. And as a community, we truly strive to support students from all angles. All of our students are also assigned a faculty advisor. You can also see noted there some of our career placement statistics. We have a very robust careers team that offers cradle to grave services and support so that students can find internships and full-time employment after they graduate as well. So choosing the right degree here, this slide essentially highlights our various degree programs. There are a couple things that I want to talk about, but of course, come visit me in the breakout room if you have more specific questions. What I'd like to note is that we do have 2 fully online degree programs in population and health sciences. In addition to that, as I mentioned earlier, being able to take those classes at any of the 19 schools and colleges. With that being said, our university as a whole offers over 97 graduate programs ranked top 10 in the country. So having that ability to learn within other disciplines, including pursuing a dual degree, as you can see on the right of your screen, is very important and something that we're excited to offer as a public interdisciplinary research institution. So on this slide, we talk a little bit about our application requirements. One thing that I can share is that there's not a specific undergraduate degree or set of professional work experience needed to apply. In addition to that, the standardized test requirement is eliminated for this year. So definitely want to stress that. What you're probably wondering is we kind of look at the total package here. What will I truly be evaluated on? And what I can say is everything that's essentially listed here. At Michigan Public Health, we truly practice a holistic review process, as one of my colleagues just talked about. Holistic really ensures that no single factor leads to either accepting or excluding a student from admission. So keep that in mind as you're preparing your applications to public health graduate schools. So this slide talks a little bit about the timelines. As you can see, all of our applications are open right now for fall 2022. In addition to that, we do have a priority deadline coming up for our residential MPH and MHSA programs that are administered through SOFIS. So please keep that in mind as we are drawing very close to the time in which you should be submitting. So the last part here is really associated with funding, and we recognize that cost plays a large role in your decision-making process. First and foremost, earlier this month, the FAFSA, which is the free federal aid form that you're able to fill out to see how much support you can get from the government, is open. So we encourage all students to go ahead and start that process. In addition to that, in terms of our Dean scholarships, again, you're going to want to make sure that your application is submitted and that it's complete before our priority deadline, again, which is typically December 1st, but check out our website. If meeting those deadlines, then you will be automatically considered for our Dean scholarships. Those are full rides, partial rides, and quarter rides. With that being said, about 35% of our students receive those. And one thing I do want to note is said here is that there is not a specific additional application that's needed. So we are on social media. Let's definitely stay in touch, but I hope to see you in the breakout session. We have social media that's very active, as well as our Population Healthy podcast and newsletter. So please feel free to reach out to us during that. Thank you so much. And I'll turn it over to my colleague, Dan, with the University of Minnesota. Thank you.
All right, thank you, Mary Beth. Hope everybody can see my slides. So again, I'm Dan Cheng. I'm with the University of Minnesota School of Public Health. You can see here is a beautiful photo of our campus. Right here, if you can see my cursor, is where our academic health center is, and that's where the School of Public Health is located. So similar to some other schools, but unique on campuses is that we do cluster all of our academic health programs in one part of campus. So that really helps foster a lot of collaboration and interdisciplinary opportunities for students. So we have a medical school, school of dentistry, nursing, veterinary medicine is actually just a little bit further down the road in St. Paul. But we also have pharmacy on the Minneapolis campus. Founded in 1944, the School of Public Health draws in students from across the country and around the world. We're number 6 in NIH funding for schools of public health. Our faculty are very well funded, and we have many firsts in our school, including the first epidemiology MPH or PhD, MHA program, and maternal child health program. Just to, here's a slide. Just to give you a little bit more context of where we're located. We are on the Twin Cities campus, which is the flagship campus of the University of Minnesota system. So in the Twin Cities of Minneapolis and St. Paul, there's a little bit of hint of a map here. So we're divided by the Mississippi River, and the School of Public Health main building is located here on the East Bank. So we're well nestled in between the hustle and bustle of the Minneapolis, city of Minneapolis, as well as the policy making hub of the state in St. Paul, just 3 miles away from us. We are situated in a very diverse community. We have communities from all across the world represented here in Minneapolis, including the largest Somali population outside of Mogadishu, as well as one of the largest populations among refugees and communities. We are also home to a number of Fortune 500 companies, including the world headquarters of Target, 3M, Medtronic, and we're also just a couple hours away from the Mayo Clinic down in Rochester, Minnesota. So just recapping some of the things I said earlier in terms of our firsts and some statistics. But the division, our academic divisions at the School of Public Health offer a wide range of master's and doctoral degree programs and house national and internationally recognized centers that provide high caliber research, outreach, and training. And so usually the best way to describe our schools is kind of run down the different divisions that we have. The Division of Epidemiology and Community Health focuses on disease and health in various populations. Our faculty and students examine the distribution, cause, and prevention of diseases and how human behavior affects overall health. So then you see here that we have MPH programs, MS, and PhD opportunities in the Division of Epidemiology and Community Health. And in the Division of Health Policy and Management, students will learn from a faculty who are reshaping and improving the rapidly changing healthcare environment, from influencing access to care to determining how a healthcare system is structured. Policy and leadership play a strong role in public health, and programs in the division will help prepare you to be a leader in the field. So you see here we have the MPH programs, as well as the Masters of Healthcare Management program, which we are currently ranked number 2 for, and the Masters of Science and PhD programs. As you see here, the Public Health Administration and Policy, as well as our MHA program, both have traditional and executive options as well. The Division of Environmental Health Sciences focuses on environmental and occupational health concerns, from investigating hazards in our environment to establishing the basis for public health policy. So here they're structured a little bit differently with the Masters of Public Health, MS, and PhD. So here there is a general program for environmental health sciences, but students in your second year will start to identify a concentration or area of emphasis, as you see here, that can range from environmental infectious diseases, industrial hygiene, environmental chemistry, and all those listed. So very dynamic program. And finally, our Division of Biostatistics focuses on the development of statistical methods for biomedical research. Through this division, we collaborate with university research partners on projects involving HIV/AIDS, heart and lung disease, cancer, neuroimaging, and many other clinical disciplines. It's currently ranked number 7 for its biostatistics program. And there you have the MPH, MS, and PhD options. Additionally, new to this division is our Public Health Data Science MPH. This program will equip students with the data management, manipulation, analysis, and communication skills that will allow them to contribute to designing, understanding, and implementing public health efforts in the future. So this program, the way I like to describe it is the biostatistics is creating the data, while the public health data science is analyzing existing data. So it's brand new. We are accepting applications now for fall of 2022. Finally, the GRE is not required for any of our master's or doctoral programs moving forward. So we're excited to eliminate that. And that is it for me. I will put my contact information in the chat. And then I believe I'm handing it back over to Nick.
Thank you so much. We now welcome all of the presenters back, and we'll just do quick Q&A. If you have any questions, feel free to ask general questions in the chat. We do not have much time for this quick Q&A. So if you have any questions that we don't answer, feel free to go into the breakout rooms and ask your questions there. All right, so the first question is how can a candidate stand out in an application? And that goes to anybody if anyone wants to take that.
I can start. I think a good way to stand out is in your personal statement to really just be genuine and talk about your goals and how do you feel that the degree, specifically speaking for Tulane, how can our degree in our school in our city help you? And just really being very genuine and upfront. And if you're applying to more than one school, always double check. You want your letters to be different. And I would say proofread your application as well, because sometimes those little mistakes can get you if it seems really generic, like it's just something you've submitted to every school you're applying to. We just want you to be genuine and be yourself in your personal statement. I think that'll set you apart.
And to kind of piggyback off of that, I think when I talk to students and then talk to faculty, in a lot of ways, this point in your career, when you're starting to look at graduate studies, you're becoming in part kind of a colleague of some of the faculty members. You're taking on some of the work, you're working very closely with them, and they want to see that you have the same amount of passion for the work that they're doing that they have. So I think, you know, kind of picking back off, making that personal statement personal, it's about showing that same amount of passion.
Great. Anybody else before we move on to the next question?
One thing that I would just encourage is just, you know, do your homework. Take time to talk to folks like us, talk to faculty. If you can, connect with a current student. And when it is safe for you do start getting admitted to institutions, try to get there so that you can see what it would really be like to live and learn in the community.
Great. Thank you so much. Our next question is, if a candidate doesn't have experience in public health, how do they craft a good application? Is it necessary to have relevant coursework? Feel free, anybody, to.
I'll go. Here at the LSU School of Public Health, there, again, and I will probably say this is true for a lot of us who talk about the holistic application process, but there is a variety of voices that need to be had in public health in general. So when it comes to your background, your previous studies, we're all going to take that into account, that we do need people with different voices and who have had different educational backgrounds. Now, there are going to be some disciplines that are going to, you know, it may be helpful to have linear algebra under your belt, but that is something, and, you know, Barry Beth was talking about it earlier, is have that conversation with the school that you're interested in to see if there is anything. But for the most part, all of us are going to look at who you are as a person and see how you would fit in with the programs, if this is going to be the right fit. I wouldn't necessarily worry so much about the checklist of classes you have to have beforehand.
One thing that I would say too is, you know, most of these institutions and within the departments, you're going to find a really mixed bag in terms of the departments and the types of characteristics that they're looking for among applicants. Some are obviously much more hard science driven and some are more on the social science end. So make sure that you contact admissions folks so that you can hear firsthand from them exactly what you need to achieve before applying. Another thing with that being said is some institutions have preferences in terms of prerequisite courses, those being recommended or required, being complete prior to applying or ongoing while you are applying. So make sure that you're clear in that distinction so that you're able to set yourself up for success as well.
Great. Anybody else before we move on to another question? No? Okay. We'll do a quick thumbs up. How many of the schools here accept Duolingo? I saw a few people responding in the chat. Okay, a couple schools. Hopefully that is helpful to those that asked that question. Another question for all of you is, how do students, whether they're in person or virtual, kind of connect to faculty members before they are on campus, or if they're not able to come on campus? What's the best way for prospective students to connect with faculty members at your institution?
For us at Tulane, it's really just as easy as reaching out to someone in admissions or going onto our website and finding the program manager for that specific department. It's very easy. Our faculty members, as I would imagine at most institutions, are super open and welcoming, especially to prospective students. So please don't feel like, you know, nervous or apprehensive about reaching out directly to faculty, as long as your ask is, again, genuine and specific, and not just maybe a general email that you sent to 10 or 15 different faculty members hoping to get a response. So don't feel like you can't reach out to them, just be specific and be patient for a response. They are busy. So super easy. I say just reach out to someone in admissions and get connected.
I would just echo that for Ohio State as well. We also offer some online information sessions where we will cover a lot of the same material that we did today, more in depth, and also have a current student panel, as well as an opportunity for you to meet with some of our faculty in your area of interest. So it's a really great way to kind of have this captive audience. Typically it's in a very small group, for you to talk with them and not feel intimidated, by cold calling or cold emailing. So we would absolutely welcome you to do that.
Yeah, at Berkeley Public Health, we do have a faculty directory, and that goes into like the faculty biographies as well. And so you can really look into the research that they're doing. And when you do reach out to faculty, I cannot emphasize enough to, ask them questions directly about what it is that they're doing. You're going to much likely get a response back. And even reaching out to a current student, like I mentioned during my presentation, we have that opportunity, and you can talk to a current student and even say like, hey, I want to talk to a faculty member in this concentration. Is there anyone in particular you might recommend?
I'll just add to that. I would echo everything that's already been said, but with the University of Minnesota, I think it makes more sense to connect with faculty if you're applying to a PhD program, more so than if you were applying to an MPH program. It's not as necessary with an MPH because we're not doing a faculty match with that. But with PhDs, you definitely want to do the research on the faculty, connect with the program coordinator of that area, and find out if they are accepting new students into their research or accepting new students that year for the programs. For us at the School of Public Health in Minnesota, we admit PhD students that we can fully fund. And so not every year are we able to fund students into a program, some of our smaller programs, but that does not go across the board. So some programs have more funding than others, and they are bringing in students every year. So it's definitely something that you want to start that investigation with the program coordinator of that area to get a sense of if they are even accepting students for that upcoming year, or if you might want to wait a year or so and start the conversation there, and then they'll help you connect with faculty too if you haven't already.
Great, thank you so much. And then we'll just finish it up with one last question, and then we'll do the breakout rooms. For any of your institutions, how students are stressed, prospective students are stressed, especially during the last couple of years. What is some advice that you have for people entering grad school and trying to manage stress, or what kind of resources does your institution provide with reaching out to those that are feeling overwhelmed?
I like to give the advice of just come when you're ready. If getting all this stuff done is stressing you out, then maybe take a pause, because I like to think that none of our schools are going anywhere. And if you need a year to take a break and to do maybe more research or to work, or just take a break from school for a bit, that's completely understandable. And we're all schools of public health, so balance is important to all of us, to all of our institutions and mental health. And so we want students to come when they're ready. Right. With that said, obviously right now is a really interesting time to be going into public health as in an academic sense and in a future career, because of the pandemic, because it's so relatable to so many people. So it is making it a very interesting time to be studying public health. So, but my recommendation is to don't rush it if you're not fully ready, invested, because when you are fully ready and invested and committed to the work, you're going to get so much more out of the program once you're in it. So kind of keep that in mind.
I completely agree with that. And I would also say, don't be afraid to have those conversations. Obviously, again, kind of going into public health, we completely understand, the obvious struggles that are going to come at a time like this, and prevention is worth it. It's weight in gold. But I think having those conversations with the admissions groups when you're there with people who had up student experience, Understanding your options. Can you take some time off? Can you switch from a full-time to a part-time? Those are all conversations you can have with your academic affairs team once you get here. So I would say, yes, take a look. Is now the time for you? And if it is, but things change, don't be afraid to have that conversation in the moment. We all know how the world works right now, and it's scary and it's hard and it's exhausting. And I, can say for at least LSU, like, we will do all we can to make sure that you get through this.
Yeah, I think something that really helped me when I was pursuing my graduate program was communicating early and often. So whether that's, with your academic or faculty advisor, whether that's with an admissions rep or, someone else on a student affairs team, like, we can't help you if we don't know what's going on. So definitely just be sure that you're communicating with people. It's okay to not have it all together all the time. Yeah.
Thank you all. I'm going to share my screen and then we'll start opening up the breakout rooms. Again, we appreciate everyone who presented today. And we look forward to, if there's any specific questions that anybody has, feel free to ask them in the breakout rooms. So we have some events coming up this week and in a couple weeks. So just visit thisispublichealth.org/events for more information. You can follow us on our social media if you want to learn more about what's going on and follow what our This is Public Health ambassadors are doing each week. I will put the link for these helpful ASPPH resources. There's a lot of questions about scholarships all the time, and you can see our Finance Your Degree resource on our website. There's also a database called the Academic Program Finder where you can search for which schools you're specifically looking for. And then we also have a digital view book that you can explore all of our programs. I'm going to send the links now to these, and then we will open up the breakout rooms. But here's the link to these resources. You'll be able to self-select your own breakout room. If you can't get in a breakout room, let us know and we'll put you in one. For those of you who are just kind of sitting in the waiting room for a while, we'll ask you a few times if you're able to join a breakout room. And if you're not able to, we will put you in one. So we labeled them each based on your school. So if all of our presenters can go into their breakout room, if you can't, we will put you in one. And thank you all for attending today.